will turn it over to you.
Thanks so much, Lindsay, and good morning to everybody. It's a pleasure to be here. I just want to start by asking, first of all, if folks can hear me, and great, I'm seeing some thumbs up. And then secondly, you should be able to see our slides here, which is a very green slide for this time in the morning, but it sounds like we're all set. So, well, it's a pleasure to be here, and I'm, as Lindsay mentioned, joined by my colleague Megan Mead this morning. We are going to be talking about a structured approach to cross-sector data sharing, and so we'll talk about what we mean by that. But really, with a structured approach, we mean not having to reinvent the wheel every time that we embark on a data sharing project. And so it's an iterative process that we have laid out in some steps that hopefully will simplify and demystify the process for you all. Let me just go to the next slide here. So yeah, I think we've already covered this. Myself and Megan are with the Network for Public Health Law in our Mid-States region. Let me just cover some fine print before we go any further. I just wanted to say that Megan and I are both attorneys, but we are, alas, not your attorneys. And so please do not consider anything that we say this morning to be legal advice. And if you do have legal questions, please consult your attorney. And similarly with the a resource that we will refer to a few times today, the Pathways TS, that similarly should not be considered legal advice. And so with that out of the way, let me just tell you a little bit about the Network for Public Health Law. So we are a national organization and we provide legal technical assistance to state, tribal, local, and territorial health departments across the country. We have about 20 attorneys on staff that are dotted around the country and that focus on different things. In addition to legal technical assistance, we also develop resources, excuse me, like the one that we will be talking about today that is available for free on our website. Incidentally, this is not a sales pitch, but you can access the resource. But we also develop fact sheets and blogs and other good stuff, and you can find those on our website. We will put the link into the chat for our website, which is networkforphl.org. And we are founded by and funded by the Robert Wood Johnson Foundation, and we are very appreciative of the support that they provide to us. Within the network, we're divided into a few different regions, and Megan and I are in the Mid-States region. And we focus often on data, as Lindsay mentioned at the beginning of the presentation, but not exclusively on data. We do certainly have a very, very strong data program, and we provide technical assistance to lots of different folks on data issues, but we do focus on other things like health equity and public health authority as well. And we have some great colleagues that are also covering our Eastern region and our Western region. We do, in addition, have different subject matter focuses as well. And I'll just go to those right now. But you see some of those on the screen here, including reproductive health and equity, data sharing, which is really Megan and my region. And then we have folks that work on harm reduction and have a whole separate harm reduction program. And then we have folks too that work on climate and similarly have a separate climate program as well that's available to provide assistance to you if you need it. And then other issues around health equity and declarations of racism as a public health crisis. We have folks that work on school health and the issues that go into providing health care and other services within the school context. And then some folks that work on injury prevention too, on bicycle safety and traffic safety and other issues. And so we have lots of expertise within the network. And as I mentioned, we're funded by the Robert Wood Johnson Foundation. And so we can provide technical assistance at no charge. And I encourage you to reach out to myself or Megan or one of our colleagues at the network. And you will find a link on our website to submit a question if you do want to go that route and submit a question online. So I mentioned just the data across sectors for health, which co-produced the resources that we are focusing on today. DASH is a initiative of the Illinois Public Health Institute in partnership with the Michigan Public Health Institute. And you can read a little bit about Dash on the slide here. They support alignment among healthcare, public health, and other sectors to share and use data to understand factors that influence health and develop more effective interventions and policies. And we are very grateful to them for the collaboration on the Pathways to Yes in developing this structured approach to data sharing. And so this is the resource that I mentioned, the Pathways to Yes, which is the subject of this resource and also the subject of our presentation today. It lays out a structured approach in several steps, 5 steps that we'll be covering today, as basically steps in approaching a data sharing project so that you don't have to reinvent the wheel every time. And so I encourage you to check out that resource. You can download a PDF on when you have a moment. And we'll also have a link to the presentation, to the resource rather, at the end of the presentation. So Lindsay already covered our learning objectives. And so let's just move on to the problem that we're trying to solve. Um, Data sharing, as we know, can be tricky and it can be difficult to share data, to exchange data for a number of reasons. There are few user-friendly guides to data sharing, and they can be hard to find. And so that was really the impetus for developing the Pathways to Yes in this presentation as well. And there can be a culture of no around data sharing, which is what we're trying to move away from. That culture of no can stem from fear of change or fear of privacy laws, to be honest. I think a lot of folks are afraid of violating HIPAA or other privacy laws. And often the easiest answer can be no. That can be a liability limiting answer. And that can be frustrating for all involved. And so, even though it often feels safer and easier to say no, we find that there is a pathway to yes, and there are ways of really examining what are the issues at hand and what is the law that applies to this specific instance. And so, in the context of data sharing, typically we will look at what are the specific laws that apply to this specific data. And that takes some analysis. And so that's some of the steps that we'll be talking about today is not just that legal analysis, but how do you talk to your attorney about data sharing? Or if you are an attorney, what are some of the considerations that you should keep in mind when it comes to data sharing? Megan and I work in data pretty much every day, but many attorneys work on many different things and may not have worked on data at all, or maybe work on data as just a small part of their portfolio. And that, can lead to some barriers as well. Just, humans are we're not machines, and so we may know a little about a lot, or we may know a lot about a little, but it sometimes does take that extra step to really focus on what are the specific issues around data and becoming more familiar with the data space. I think folks also have a concern sometimes about control of the data. Often I hear questions around who owns the data, and folks can have some trepidation about if they do share data with somebody, where will that data end up? Will it be redisclosed? Who will get their hands on it? What will it be used for? Could it be returned? And those are very valid concerns. And so some of the things we'll talk about today include things like data use agreements and how do you reduce a data sharing agreement to paper so that you do have control over what happens to the data and who uses the data. And even the specifics, not just about what organization you share the data with, but who specifically at that organization can access the data. Those are some of the things that you can outline in a data sharing agreement. And then I think also capacity and just staff time and constraints around staff. I know we all are aware of workforce issues, not just in public health, but in other sectors as well, particularly following COVID. And people are stretched thin, and it does take time to really dig into a data sharing project. It's not a small undertaking. And so I think that can also lead to this culture of no as well, that sometimes it's just easier to say no rather than get involved in some huge project that's going to take up a lot of your time, which in some instances, we think to ourselves, I just do not have the time for this. And so that's one of the barriers that we have to get over as well. Um, and so we mentioned also about data use agreements, but that data agreements in and of themselves can be very time consuming, going back and forward, negotiating terms over a data sharing agreement. Honestly, like I think several of us have been in that situation of going back and forward on a data sharing agreement over different provisions, and by the end of it, sometimes you just do feel like I can't even look at this data use agreement anymore. And that's just the beginning or one part of a data sharing project. So that's what we're trying to address today is these problems and these barriers around data sharing. But let me take a pause here, and I think it might help, given that uh, we don't know each other, but let's get to know each other. So I thought it might be helpful. We thought it might be helpful if folks want to enter into the chat what is their title or their role within their organization. And if you want to share that with other folks in the room through the chat. If you want to include your organization name, you can do that. If you don't feel comfortable sharing your organization name, that's totally fine as well. But I think this might just give us a chance to get a handle on what your expectations are from this presentation and what your comfort zone may be with data. And so thank you, Lindsay, for starting us off here. Looks like we have assistant professor and an AoS librarian, so that's fantastic. But if folks want to take time as well to just enter what their title is in the chat, you're welcome to do that. It looks like folks might be a little shy. I hope nobody's experiencing uh, any problems. So it looks like maybe there might be some problems in sharing information in the chat.
I was going
Uh,
to say, I'm getting a lot of direct messages, and I heard in the intro that there was an issue with the chat. So I wonder if, yeah, someone says, I don't think we can send to the full group.
uh,
So, okay.
okay. Thanks, Megan. Thanks, Megan. Well, so I guess, Megan, feel free to jump in here, but it does seem like we have some epidemiologists, we have director of data sharing, and thank you, incidentally, for figuring this out and sending us some direct messages. I'm seeing also some program planners, folks from a health department in Lansing in Michigan, senior community epidemiologist. Megan, what are you seeing in the chat? Are you seeing similar titles?
Similar titles, yep. Nurse, looks like we have some business system and finance people. I've seen a couple librarians, I think. Population health advisor. Yeah, it looks like people are from all over. I saw New Hampshire, Iowa, um, Missouri, Santa Clara, Michigan.
Great, great. Yeah, and I'm seeing similar info here. Folks in Kentucky, project manager, public health strategist in a mid-sized local public health department, community needs assessment coordinator. So lots of different folks, it seems like in a few different sectors. Some folks, several folks in public health, it looks like, but some other folks as well, including maybe some academic positions as well. I'm seeing director of administration and support services overseeing CHA and CHIP in Stark County, Ohio, an epidemiologist in Black Hawk County, quality improvement epidemiologist in Ohio. So this is great. Thank you all for sharing your roles, and this gives us a handle. It certainly sounds like everybody's in the right room. We're seeing a lot of epidemiologists, and I'm always extremely impressed by epidemiologists. And I call on epidemiologists a lot to explain stuff to me around data. So glad you're here, and glad everybody is here because it certainly seems like a lot of people are bringing a lot of different knowledge base and a lot of different skill sets to the table. Um, okay, well, if I can burden people with this chat issue again, we have another question here, which is really just, have you been involved in a data sharing project in the past? And if you want to enter in the chat to either myself or Megan, that might help us too in just understanding what the baseline is here if folks have been engaged in a data sharing project in the past, because that certainly does help us know kind of where we're starting from today.
So I'm getting a few no's. So, I mean, you're in the right place, but we've got a yes. So, yeah,
I'm seeing
yeses are
several
in the right
yeses.
place too.
Yeah. I am seeing several yeses. In fact, I think I'm seeing about 90% yeses here. So some folks saying that they work closely with healthcare providers, other folks sharing basic data with health system, started an EHR project, an electronic health record project. That sounds fascinating. But it looks like it reached a stumbling block due to issues with the health system. So certainly have encountered those kind of barriers before. Um, and someone here is part of a community committee that's working on formalizing agreements and data sharing with behavioral health and primary care groups. So it certainly sounds like everybody's in the right room here. Other folks that work on data requests and some folks around, looks like working in data around criminal justice and the health system,
Hmm.
which sounds fascinating, and a childhood-led program, which is near and dear to my heart. I've worked on several lead data issues in the past and trying to share lead data to prevent children from getting poisoned by lead. And nevertheless, the data sharing can be problematic. It can be difficult to share data. So um, in any event, I'm still seeing some great answers here around trying to get local clinics and hospital data and coroner data on suicide-related data issues. So let me pause there and maybe we'll just move on to our next slide. If you do have questions during the presentation, please do enter them into the chat for either myself or Megan, and we will be happy to address that. I try to keep a track on the chat. It's easier to keep an eye on the chat when you're not talking. So maybe once I pass the baton over to Megan, I'll have a look through the chat as well if folks have questions. So with that said, let's keep on moving here. And so we were talking about the problem a few minutes ago of data sharing and some of the hesitation that people have in saying yes, which often leads us to sharing no. And you see just an example on the screen here with a couple of projects. You see a county public health department wants data from the county jail on inmates who have substance use disorder history to do pre and post-release prevention work. And so those are obviously very laudable project goals. And then another example here of a school district and local federally qualified health center wants to share data, including attendance records and medical records and treatment plans to reduce absenteeism due to medical issues. And so wouldn't we all like those projects to succeed? And certainly the goals look like, they could really have an impact on the community. But, we do encounter these barriers. And so folks like Megan and I and other attorneys that work in this space frequently deal with many different privacy laws, including HIPAA, which I'm sure we've all heard of, even if we don't work on it every day, like Megan and I. But HIPAA covers and governs not just the exchange of data in the hospital context, but physician offices and pharmacies and labs and other folks. And so it's a daily issue for many of us. Part 2 that you see on the screen here, 42 CFR Part 2, relates to substance use disorder data and some federal requirements around that. FERPA relates to education records. It's a federal law that governs the privacy of education records. And then state laws around privacy. Megan and I work on issues that involve state law frequently. We often think of federal laws as being, the place with the action in the context of privacy. But in fact, particularly in the public health context, state law often is where I end up more often than federal law. State laws in the public health context, in particular, around things like HIV or STI or communicable disease or lead, as somebody mentioned in the chat a few minutes ago, or TB. All of these different data sets often are governed by state law rather than federal law. And so those are other considerations as well. Mental health records, that's another issue of state law. Often states do have confidentiality provisions around mental health records, which are intentionally very strict around who can access mental health records and what they can be used for. And those uses tend to be very, very limited, and rightly so, to make sure that those records don't fall into the wrong hands. Minors records as well, another issue, and often a thorny issue too, around who can get access to minors records. And even when parents cannot access a minor's record directly, or if there are protections around a minor's record, such as if the minor seeks STI treatment or substance use treatment in some jurisdictions, that those records are protected. But, in the healthcare system in which we find ourselves, there are things like explanations of benefits that come in the mail. And so those issues can be around privacy can be tricky. But in any event, we're talking about data exchange here, and so many of these different barriers that you see on the screen just come into play often. And so this is where we see this culture clash is, this desire to have these data sharing projects that will lead to great outcomes, but these barriers that we see in the form of the law. And there are real and perceived barriers as well. Sometimes the barrier is real in the sense that there is a prohibition in the law that prohibits the data sharing. Other times people may perceive a barrier and may cite, well, I can't share that with you because of HIPAA. And sometimes that's just not the case. Sometimes HIPAA doesn't even apply. And so those are some of the myths that we have to get past as well. And so Megan, I guess before we move on to the pathways, can I pass this one over to you to explain the lovely rainbow in the slide?
Sure. So this is just meant to, be a good entree into pathways. That it's a framework that's going to make everything sunny and rainbows. No, but in all seriousness, we do think it is a really beneficial resource and framework to those doing the data sharing and those providing legal advice. So if you're on the same page, it can really facilitate those visionary data sharing initiatives, which can hopefully lead to improved health outcomes. So I know we had a fairly long introduction, but we are going to actually move now towards providing you the strategies to overcome the culture of no. We'll present the 5 steps of the Pathways to Yes approach with the steps that are most directly related to your work. You will hear us talk a lot, or at least me, we'll say the Pathways to Yes is a legal framework. So you may hear us sort of use that terminology like legal framework, legal work, talking with your client. But I do want to emphasize that the Pathways to Yes framework is it's beneficial to everyone. So using it early on in a data sharing initiative with all your partners can really help things move smoothly along. Of course, we do always recommend bringing the attorney into the project early because they can really provide that legal lens early on that will prevent you from getting tripped up later in the project. So you can go to the next slide. And I can just cover this one, Stephen, because the case studies are next. So here you can just see the 5 steps that we're going to be walking through. The first is to review your relationships. The second is to develop a use case. Third is to develop a data flow map. Fourth is to conduct the legal analysis. And then 5th is to establish the terms of sharing. And this is typically done with a data use agreement or a data sharing agreement. Next slide. So the Pathways to Yes resource, it includes five case studies. There's one on housing and health. There's another on opioid misuse prevention. You can check them out in the written resource. I did put the link in the chat, but I don't know if I'm able to send to everyone. So the link is also embedded in the slide presentation. So you can access it after or just look it up, Network for Public Health Pathways to Yes, if you want to take a look. But anyway, the 5 case studies each follow the 5 steps and provide examples of how the Pathways to Yes framework can help you plan a data sharing project. And so we chose the housing and health case study to weave through today's presentation so you can see pathways to yes in action. So as I'm sure just about everybody here is aware, housing security and quality are closely linked with health and well-being. People without access to secure, stable, high-quality housing are at an increased risk of experiencing negative health outcomes. So to improve health, communities can invest in interventions that support housing security. But you need to understand, or communities need to understand and demonstrate that relationship between housing and health. So this particular case study that we're going to be walking through today, the objective is to provide greater insight into the relationship between housing and health and those system-focused connections, which will ideally inform future interventions. And this project will achieve this by documenting how health outcomes improve when resources are invested in housing, and how the health of it's going to be a county-based project, how the health of the county residents improves. Next slide. Oh, no. Yep, there we go. Thank you. So this project is going to rely on public housing enrollment data and Medicaid enrollment and claims data to develop a longitudinal record. So the data is going to need to include enough personal identifiers to gain insight into service utilization where the target populations overlap. So in other words, you're going to need to be able to link these 2, or actually it's going to be 3 different data sets. And once the data are linked, the system and community level information can then be presented to stakeholders and members of the public. And so on this slide, you can see the core data elements, the personal identifiers, which are going to be important, several elements of address, and then the chronic condition diagnoses and the utilization of healthcare services. So I'll turn that back to Stephen now.
Thanks so much, Megan. Let's get started then. Let's kick into these steps. And step number 1, as Megan mentioned, is to review your relationships. So what do we mean when we talk about reviewing relationships? We talk about both internal and external relationships. And so starting with the external relationships, this really is the basis for most data sharing. There is trust involved in data sharing. And so folks typically will want to have that trust with who they are sharing data with. And so that's why these external relationships are important, is to build that trust so that you can hopefully down the line exchange data with folks. And also, it's not just the sharing the data, but helping identify what the problem is and what the objectives might be in trying to embark on a data sharing project. So trust really is the underlying value, within data sharing. If folks do not have trust in who requests data, then they may not share the data. And so this external partners then breaks down into 2 additional subsets. You have existing partners, and then you have new partnerships as well. And so you're likely to be more efficient and to make quicker progress on your data project when you work with existing partners. And this is true even if the data sharing has not been the focus of your collaboration in the past, but can be a focus as you go forward with a data sharing project. And new partners similarly are important, who may be engaged in similar work or may be engaged directly and connected to your work. And so that has a positive impact as well. And assembling the right partners and deciding on the problem can go hand in hand. And so the other part of this then with relationships is internal relationships. And that really involves bringing the right people to the table in order for a data sharing project to succeed. And those folks internally maybe people like a project manager or program folks who, work on a program and will be the ones that want the data and will be using the data. Information security people are also important to have at the table at the beginning of a data sharing project. Obviously, privacy folks, whether that's a privacy officer or a privacy attorney, if you're lucky enough to have attorneys on staff. Informatics folks, if you have those on staff too, would be important to engage in the data sharing project at the outset, and IT people similarly. And then a project champion, which is a representative from your organization in middle or upper management who can add some clout to your project to make sure that you are getting buy-in from the leadership in your organization from the outset and not asking for support when you have gone down the road of doing work on a data sharing project and then finding out that you don't have support from your leadership. But that can be helpful. The project champion can be helpful for getting additional resources if additional resources are necessary. And even just those relationship pieces too that folks higher up in your organization may have some important connections as well that they can connect you with to add some additional help to your data sharing project. And then we'll talk just in a moment. In fact, let's talk about it right now, but the role of the attorney in a data sharing project. And so Megan mentioned this already, but really the role of the attorney begins at the inception of the project. And that is because if you go down the road of embarking on a data sharing project and doing a lot of work on it, it really would be very difficult if you get further down that road only to find that the path that you've taken is untenable. Maybe the data sets that you want to get your hands on, you just can't get access to because they are protected by a law that's inflexible and that will not allow access to the data. But there are other reasons as well to involve the attorney at the beginning of the project, and that includes the fact that if you are involved in a project at the beginning, then you tend to take some ownership over it, and you tend to have a vested interest in the success of the project. And so having that attorney around the table at the beginning of the project is very important for a number of reasons. We do recommend that you do some homework before you approach your attorney about a data sharing project. And by homework, I mean figuring out what are the project goals and the desired outcome. Megan is going to talk about use cases and how to develop those, but that's an important thing to bring to your attorney as well. So that they understand the project and understand what the goals are and what data may be necessary to achieve those goals, who has the data, what type of data it is, and how that data might be shared. And we also recommend that, in approaching your attorney, it is better to avoid a situation where you ask for a yes or no. Can we do this? Yes or no? And we say that, out of experience, that often it's more nuanced than that. It's more nuanced than just saying yes or no. And so I think a better approach is really to present that homework to an attorney, explain what the goals are and explain what your plans are, and get buy-in from the attorney and some solutions from the attorney on how to move forward rather than a yes or no question. And that, similarly, this is where having a project champion come into play too, in those instances in which maybe you do get some no's from attorneys or others, it can be helpful to make sure that you have somebody higher up in the organization who wants this project to succeed, because that can sometimes cut through those no's to find a pathway to yes. And so again, if the attorney feels invested in the project, then they can have more of a commitment in the project and can feel a better sense of ownership to have the project succeed. And another reason, as I mentioned, for involving the attorney at the beginning is really to avoid that situation where you're asking the attorney when the project is halfway through to get involved and to figure out legal solutions to problems that they may feel are not theirs to solve, or perhaps feel slighted that they weren't involved in a project from the beginning. So having the attorney in the beginning of the project is very, very important. Okay, let's move to the next slide. And so we talked about the housing and health case study, which Megan very helpfully ran through a few minutes ago. And just looking at this step number one, what that would involve in this particular case. So reviewing our relationships in the case of the housing and health, it's a collaboration among numerous stakeholders, as the description outlined, and those stakeholders include a county housing authority and a municipal housing authority, state health oversight agency, a county health department, and the public as well. And so in this particular project, the collaboration, the folks that were moving this project forward, chose the county health department as the central data hub for a number of reasons, as you see on the screen here, and chiefly that the county health department is already very well versed in handling data and handling very sensitive data, things like maybe STI data or HIV data, or other very sensitive data. And so in this instance, they had a existing data privacy program that they were able to lean on to make sure that the data was protected. And then the county health department also had internal capacity to analyze and interpret the data. So maybe they had some epidemiologists that were equipped to work on the data as well. And then collecting data for population health surveillance is generally conducive to longer retention. And so this is just an example of how this step number one would play out in the case study that we focused on already. And so with that, I'm going to pass things over to Megan to talk about step number two.
Thanks, Stephen. So step number two is to develop a use case. We can just go to the next slide. So your use case is the written guide to your project. Developing it prompts you to think through all the major decisions that you'll need to make to avoid surprises once you're deep into the project. So it can help identify and resolve important project elements like who, what data, how is it being used. It can contextualize and provide a concrete example of what you're trying to do. Ideally, it will contain all of the critical information to communicate the value of the project and achieve buy-in, and it can help identify and resolve any legal issues with the proposed data sharing activity. We can go to the next slide. So I think of a use case as having 7 building blocks. So the first is your objective or your health objective. What's the goal or aim of this project? And the second is, what do you want to do with your partners together? It might be a specific intervention, although in the case study that we're working with, that's not actually an intervention, right? It's more of analysis or evaluation or research. Then you also want to think about the data purpose and uses. So what information do you need to achieve the project goals, and what is the specific purpose for sharing the data? And then you want to think about data sources and types. So what is the type of data you'll need, and what are the sources of the data? And then we're going to get even more specific and think about the data elements. So what specific data elements will you need for your project? So, many data sets have 100 or more elements. You might not need every element. You may need 10. So that's one way to limit it. Then you're going to think about the method of transmission and storage. So how will the data be transmitted or stored? And are there laws that govern the data when it's moving, or moving from point to point, or when it's being stored? And then you want to go back and revisit who your partners are. So when you can see how when you've asked these 6 questions or you've answered these questions, you may identify or realize there's other partners or stakeholders that should be at the table for this initiative, or that should at least be looped in as a courtesy. You can also see how being prompted to think through the use case can help identify potential obstacles to the project, including some that may be legal. For example, if the applicable law requires a certain level of data security, Data system security or the use case may help identify if the data sharing is going to be ongoing or point in time. These can all have a legal impact. So we definitely encourage folks to develop a use case and early on in the process when you're exploring the data sharing initiative. The other thing I'll note about a use case is it doesn't have to be the only case or even the end case. So it can be a way to initiate a project with a small set of partners with the vision of an expanded set of partners at some time in the future. And it can also be a way to establish proof of concept that what you're proposing to do is legally and technologically possible before going all in with funding and resources on a large scale effort. So if you look to a lot of the largest and longest running data sharing initiatives, and I'm thinking of like states here that have statewide integrated administrative data systems, they often started small and as they got traction, gradually expanded. So it's okay to start small and grow. Next slide. So I want to take a minute to address consent issues since they are a part of many data sharing efforts, particularly those involving PHI. Data privacy laws are designed to balance an individual's personal privacy interests in their information with the public good or the public need for that information. Reasonable people can and do disagree on where the balance should be struck, and the balance can change over time based on societal opinions around privacy. Excuse me, and the balance may also change depending upon the specific use case or data sharing initiative. So consent is often a big stumbling block, with the law at times not permitting disclosure without express patient consent. So part 2 comes to mind, and I saw some comments in the chat about part 2 and behavioral health information being hard to share. So part 2 has very limited exceptions as to when you can share the information without patient consent. And there's some types of data sharing initiatives that are nearly impossible without consent. So I don't know if anyone here is familiar with community information exchanges or social health information exchanges, as they're sometimes called. These are usually collaborations between healthcare providers and social service organizations that are sharing identifiable individual level data to coordinate care and services for people. And they're always predicated upon consent. You can always seek consent, but sometimes the numbers or operational realities make that infeasible. So say you're doing a data sharing initiative involving Medicaid data. California has like millions of people on Medi-Cal. And if you tried to seek consent from every single person on Medi-Cal before you did your data sharing initiative, it would never get off the ground. So, it's just not realistic sometimes. So you can look to laws that may provide additional permission to share data. For example, HIPAA has exceptions for research, and you can also disclose PHI to public health authorities when requested for purposes of public health activities. So some laws do have exceptions to which you can avail yourself. And depending upon the data sharing initiative, you will need to see, does consent have to be obtained? Should it be obtained? Or is it possible without obtaining consent? And there are risks to not sharing data if we value the privacy interest too highly. You can really miss out on important information that can improve public health and better serve the public. So the risks with data sharing or not data sharing kind of go both ways. And again, that's why we're balancing that. And I also want to mention that while this presentation, we're focused on a legal framework to achieve data sharing, there's a lot of other considerations besides legal that are implicated by data sharing that I do want to take a moment and elevate. So this includes ethical considerations. So just because you can share data for a particular purpose, should you? Thinking through whose information are you using and to what end? And along these lines, equity concerns also come into play. So is there an equity lens on the data use and the purported goal? And I would also think about community input and buy-in around data sharing. And I think this also ties into ethics and equity as well. So some of the most successful data sharing initiatives have a defined role for community input, or they've brought their ideas to community members to solicit feedback. And you can go to the next slide, Stephen. So continuing with the case study on housing and health, and this is also based on a real life example. So you can see our objective, which is to obtain insight into the relationship between housing and health, which may inform future policies and interventions. The partners are the county and municipal housing authorities. They're two separate entities. The State Health Oversight Agency, the county health department, and members of the public. And the data sources are identified. So it's going to be public housing enrollment data and then Medicaid enrollment and claims data. And the data elements are again laid out with specificity. So you can see that we have the identifiers, the addresses, the chronic condition diagnoses, and the utilization of healthcare services. And then we have the legal issues. So due to the protected nature of Medicaid data and public housing data, we'll need to understand the applicability of various laws. Possibly HIPAA, but probably HIPAA, but likely not only HIPAA because there's multiple entities involved in here, and this is the State Health Oversight Agency. It's not the state Medicaid agency, so it may not be a covered entity. But looking at the legal issues, we will need to suss out what legal agreements need to be in place for the data sharing to occur. And so this data project is going to, because it will develop a longitudinal record for clients, and it is going to need those identifiers to see where the target populations overlap. So it will need to be able to link that data. So you can see how that information in there, like that's the crux of the project. If you don't have that, then you don't have the project. So you can see how that information has made its way into the use case. Next slide. Okay, so step 3, create a data flow map. This is actually my favorite one. And this is a really crucial step in developing a data sharing initiative. So the data flow map is going to diagram how data moves within your project from one stakeholder to another. It will identify every point where people and systems interact with each other and where and how data is transported. And the intersections of data will have legal consequences, so you really want to make that diagram as complete and accurate as possible. The data flow map will be used by stakeholders, including information security, the legal team, and project management to help visualize the project and identify the legal strategies and determine information security controls at the data sources, endpoints, and everywhere along the way. So your map is going to help you understand who are the players? So who's going to handle or see the data? What's the data flow? Where is the data created, stored, processed, shared, destroyed? So thinking through what's the overall life cycle of the data. And it will help you think through how the data is transferred and what are the different technologies that will need to be involved, who at the various points is responsible for its overall integrity and security, where is the data identified or where is it de-identified, how is it encrypted? So not all of this is actually going to be on the data flow map, because that would be a lot, but it will provide a visual context of how the data flows so you know the entities that you'll have to ask these questions of and help identify the laws that will apply. Formatting is important. You definitely want details on the direction of data. Is it going this way or that way or both ways? I think it's helpful to use color coding or standardized symbols because then you can put more on the map without overly taxing somebody's, it's not like a visual mess to look at. And then the last thing I'll note is that the data flow map is not a static document, so it will change as the project evolves. And we can go to the next slide. So here you can see the data flow map from our case study. Again, the goal of this project is to better understand the relationship between housing and health and underscore the idea that housing is health. And it will inform the policy changes to hopefully increase housing security and improve the health of people. So in the upper left-hand corner, it says State Public Health Oversight Agency. Actually, I think it should just say State Health Oversight Agency. So they will be sending the identifiable Medicaid enrollment and claims data to the local health department. And then you have the county housing authority and the municipal housing authority, both who will be sending HUD enrollment data to the local health department. The local health department's going to take that data and they're going to link it and then they will de-identify it and they'll share that information out with the public housing authorities and with members of the public. And so we can go to the next slide. Oh, next slide, Stephen. Oh, sorry, you're there. Never mind. Little delay on my end. So this is just one more data flow map that I'm just going to walk you through just in case you haven't seen these before and just get some familiarity with it. So on the left-hand side, we have the patient who goes to their healthcare provider, who makes a diagnosis that ends up in the patient's health record. And then that information, the diagnosis was cancer, and it is shared with the state cancer registry. And then on the other column, we have an employee who has an occupational exposure. So they're exposed to something at work that's reported to the employer, and it ends up in the employment and environmental records at the state occupational safety agency, who then sends those to a university research database. So the university research database sends over that identifiable employment data to the state cancer registry, where they have a linking tool. And so they're linking their data set of all those cancer diagnoses with the employment, with that employment data set that's going to show those employee occupational exposures. And then they'll de-identify it. So they'll take out names and addresses and all that, and they'll send it back to the university research database, where it will be analyzed by a public health analyst. And so, for example, I'm totally making this example up, but maybe they'll find that employees that have, like a benzene exposure in their eye have a 5 times higher rate of ocular cancer. That's not necessarily causative, but certainly it suggests, it indicates that if employees have that kind of exposure at work, maybe they should be subject to higher screening because they are at higher risk of developing ocular cancer. Next slide. So we have another question to put in the chat, and it is, what barriers to creating an accurate data flow map have you encountered most often? Or if you have not created a data flow map, what would you anticipate would be the biggest barrier? So we have some options here: lack of familiarity, poorly defined roles, incomplete information, obscure processes, or getting overwhelmed with details. But if there's others, feel free to dump them in or type them in, and then we can take a minute and lift them up and share with the group. Number 1, so lack of familiarity with data flow maps. Looks like 2 and 5, poorly defined roles and responsibilities, getting overwhelmed with details. Okay, lots of 1s. 1s, 2s, I see a 3. So seems like poorly defined roles and responsibilities.
I'm
Yeah, I
seeing
can.
4 and 5 as well, Megan.
Yeah, okay.
And getting overwhelmed with details.
Mm-hmm. Okay. Yep. All right. So it seems like we were kind of somewhat evenly spread amongst the numbers based on my unscientific visual survey. Yeah, getting overwhelmed with details again. Getting buy-in, somebody wrote. I definitely understand that. I know my own experience. Stephen had mentioned having a project champion before. And there's sometimes this balance between like getting buy-in from people higher up, but then the people higher up don't necessarily have the time to do the actual project. And so you're in the situation where you're like, well, they said they liked it, but they're too busy to, so yes.
I'm seeing number 1 here as well, Megan, the lack of familiarity. And actually, on that point of the project champion, yeah, I've definitely experienced that too, where just like you described, that you do get a project champion who's higher up, but then they don't have time to dedicate to the project. I've heard it described also as an executive sponsor, but I have found in my experience at times that just dropping their name in conversation can tend to have people sit up in their chairs, so that can help as well.
Yeah, no, I totally agree. If you can honestly say unambiguous support from so and so, we're moving forward, then it does tend to make it turn a little faster. Funding, that's another one. Yeah, and I don't think we have time to get into this today, but a lot of the data sharing initiatives we're describing or maybe even all of them actually in pathways, I'd have to go back and double check, are voluntary, right? And so it's not this like mandated, this system has to be interoperable with this system. And so that it's kind of things people are taking on, in addition to the regular work of keeping the lights on when you're working in government. So that, that comes with additional challenges. But I will turn it over to you now, Stephen, to take us through step 4.
Thanks, Megan. And we are getting there, folks. I know there's a lot of information that we're presenting this morning. We're on step 4 of 5, so bear with us for a few more minutes, and then we'll open things up to questions. So I'm going to talk about conducting the legal analysis. And you may be sitting there thinking, well, I'm not an attorney, so why do I have to concern myself with legal analysis? Or maybe you're sitting there thinking, I am an attorney, and why are you telling me, how to conduct a legal analysis? But I think, even for those folks that are not attorneys, I think it really helps to understand what the thought process is for attorneys and what information the attorney will need in order to conduct their legal analysis. And so we do recommend that, as I mentioned earlier, when you do interact with the attorney, that you have some documentation on hand, that you have your homework done. You should be able to explain what the project is and maybe run through the use case that Megan mentioned. And then hopefully the goal is that the legal analysis then will help to figure out how to make the law work for the proposed data sharing. And so some of those pieces of information that will be relevant then are the data, obviously, and that will include like specific data elements and data sources, because the specific types of data will often determine or help determine which laws will apply to the data. I mentioned earlier just examples of in a health department, you may have communicable disease data, which may have separate rules and regs or statutes that apply to that data versus HIV data, which often has elevated data privacy protections as well. You may have STI rules, you may have around STI data and what can be done with that data. So just some examples of, different data sets can mean different laws that apply to the data. And then, excuse me, another big question that and I'm sure most, if not all, data attorneys will ask when presented with a data sharing problem is, what is the purpose? What is the reason for accessing this data? And you really should have a well-articulated answer to that question. Because I'll just tell you from experience, in the past when I've asked folks, well, why do you want to get your hands on this data? I've heard, in all honesty, in response, I don't know, it would just be good to have, or I don't know, we'll figure that out once we have the data. But it really is impossible to do legal analysis when you don't know what the purpose is for using the data, because the exercise really in many data privacy laws will be to look at the privacy law and figure out what specifically can I do with this data, or at least for what I want to do, does that fit in to the perhaps enumerated purposes for which you can use or share the data that might be outlined in the law. Perhaps the law you're looking at may say that data may be shared with a researcher for research purposes, or it may have more specifics like in HIPAA, where it'll say, can be shared with a research project as long as certain criteria have been met, such as it has been reviewed by an institutional review board and they have determined yada, yada, yada. So this purpose is very important, because whether or not the data can be shared will depend on what the data is going to be used for. And so this will lead then to a landscape analysis of all the relevant laws that may apply. And that, certainly just in the example of Megan and I, we work with data laws all the time. And so there's some that, yes, we are very familiar with and we deal with all the time. There are others that might be a little bit more obscure, and that landscape analysis really determines what are all of the requirements that might apply to this law. And I'll talk in a second about what do you do when there's more than one law that applies. But really then the task here with this legal analysis is to find a pathway to yes. And there may be instances in which the initial answer is no, but we'll talk about that too in the course of step 4 about, what can you do when the initial legal analysis determines that the answer is no. But so these, privacy laws that may apply will each have prerequisites or conditions or limitations around the sharing of the data. And that requires analysis too to figure out what are the limitations that apply in this instance, or are there conditions, criteria that have to be met? I mentioned the example of the research, like does this have to go to an IRB to determine, well, first of all, that it's research, but then HIPAA has another requirement around IRBs determining a waiver of authorization, and that goes to Megan's uh, point about consent. That sometimes it's practical to obtain consent from folks, sometimes it's not. But so that the law will dictate that often as well, as to whether or not you can share the data without consent. So we'll talk about navigating some of these barriers in just a second. But so like some of these legal considerations that we have then around the legal analysis are things like federal, state, and local laws. And in this country, we have different levels of government. We have federal government and state government, and we have local government. And each of those levels of government has law that it makes. And so it may be necessary to untangle what is what are the requirements of this federal law, maybe FERPA or HIPAA or Part 2 versus this state law. Maybe there's a state law around electronic data in general. Maybe there's law around safeguarding electronic data of residents of the state. Maybe there's laws around medical records, for example, if you're accessing records from an electronic health record. There may be state laws around that, or even just a hospital licensing act and what those requirements are around confidentiality of records. And then local ordinances as well. If there is a jurisdiction that is a local jurisdiction that has authority to make ordinances, then they may come into play too. That's not as common, to be honest, in the context of these data sharing problems. It's not unheard of, but often where the analysis comes into play is this federal versus state. And then you have this issue of preemption too, which we could have a whole separate seminar on, which I wouldn't be able to teach, to be honest with you. But this is the concept of some laws governing even when there are other laws. And so this federal preemption is when, if there are federal and state law that apply to the same subject, then the federal law will typically preempt, meaning the federal law will be the one that controls versus the state law. And as I mentioned, it is more complicated than that, but that's just the concept as well that comes into play. And then you may have situations where you have provisions that are more specific, more strict than others. And so you maybe have two laws that apply, and maybe one law allows for sharing the data for statistical purposes, and you have another law that doesn't, but they both apply to the same data, and that can come into play. And in the public health context, for example, you may have, I've mentioned these a few times, but HIV and STI, maybe you have HIV data and you have a law that applies to confidentiality of HIV data. And yet you also maybe have a law that applies to STI data, and that law defines HIV as an STI. And so you then have, competing laws. And you have this issue then about the most restrictive tends to govern. So that's kind of the context in which that can come up. And similarly with this general versus specific, I mentioned this example of like STI, for example. You may have a law that applies to STI data, but you may have another law that applies to all data that's maintained by the health department. And it has general provisions around protection of data. And I would consider that to be the general law, or a law that's more general in that scenario, versus the specific law that might apply to STI data. So I'm just keeping an eye on the time here. And so I'm going to move up just a little bit faster to make sure we cover everything. But obviously then you do need to involve your attorney in the legal analysis. This is just an example of the many different privacy laws that may come into play, and I'm not going to read through them all, but it is, it's a broad spectrum of different laws that might apply to a specific data set, might apply to a specific data project. for a specific purpose. And that can include everything from health information privacy laws, whether those are broad or narrow. Washington State has a new My Health, My Data Act, which applies to health data specifically. Or you may have other laws that apply more generally to maybe a breach of data law in a specific state that might apply to the data as well. So again, I won't read through each of those, but just to give you an idea that there are many different considerations that come into play. Okay, I'm going to try to cover this pretty quickly, but it is important because your attorney or you, as you look through doing some homework, may find that the law is just not on your side and you can't access the data given the law that applies to the data. And so it may be necessary to think of strategies that might get you past that might allow you to continue with your data sharing project on perhaps just a slightly different track. And so one strategy in that scenario is to find similar data. There may just be other data held by somebody else, perhaps that may get you to the same outcome, or at least help you do some analysis. Obtaining consent is another strategy. When we deal with privacy laws, often there is a kind of bedrock assumption that if you have the consent of the individual, you can share the data. And then each of those laws will typically, not always, but typically have a list of permissible uses and disclosures without consent. And so that's often where we go, is to look at what are those exceptions to the consent requirement. But perhaps there may be instances in which you have the consent, or you can get the consent of the individual. And Megan mentioned the community information exchange example earlier. That's a good example where the whole thing is predicated on consent. Using de-identified information instead of identifiable information, that has its limitations because it is difficult to link data, or impossible to link data sets when they're de-identified. Restructuring your relationships. So that relates to just some different concepts. Like in HIPAA, there are permissible uses and disclosures for research, for example, and there are other permissible uses and disclosures to a business associate. And we don't need to go into what that is, but there may be times when you're thinking, oh, this is research, or this is oversight, health oversight, but you end up having to change direction because perhaps you have an IRB, for example, that determines that this is not research. This does not meet the definition of research. So it may be necessary to rethink what those relationships are in terms of releasing the data, or who's accepting the data, et cetera. And then maybe redefining your whole approach. So it's similar to, I think the research is a good example of where, I've had situations where something goes before an IRB and the IRB determines that this is not research. It looks like research, but under the definition that's provided in the common rule, this is not research. And so it may be necessary to rethink then, okay, well, what could this be? Or what, if it's not research, what is it? So redefining that overall approach, and then modifying your organization structure. That's a very specific reference to hybrid entities under HIPAA, which we don't really have time to go into, but it's just there are mechanics within HIPAA that may allow you to carve out parts of your organization that are subject to HIPAA and parts that are not. That's a longer conversation, but just to give you an idea that there are alternatives if the analysis leads to no initially. So just applying this again to our case study, which you'll see again on the right-hand side of the screen. But in this particular case study around housing and health, it may involve Medicaid applicant and beneficiary information safeguards. So those, privacy restrictions or safeguards, those are administrative, physical or technical safeguards around data. State law governing Medicaid data, that is also likely to come into play. And then there is a Federal Privacy Act, which governs data that's maintained by the federal government. And then HIPAA as well might come into play in this particular scenario. So lots of legal analysis to do in that particular example. Megan, I'm going to pass the baton back to you.
Thank you. I'm going to go kind of quickly because I do want to have at least a little bit of time for any questions at the end. So we've mapped the relationships. We've done the use case and a data flow map. We've conducted some legal analysis. Hopefully the attorneys have been brought on early in the process. So now it's time to talk about the legal agreements for data sharing. Next slide. So I'll just ask this, and if people want to put it in the chat, that would be great, but I'm gonna keep going and then maybe mention some of these at the end, just because I know we are coming up on time here. So what do you find to be the most challenging aspect of drafting a data sharing agreement? So go ahead and put it in the chat, and then we will, if we have time, we'll share some of those at the end. So in this final step, we're going to walk through establishing and documenting agreements for sharing data, understanding DSAs, DUAs, and MOUs, and then identifying the elements of a legally enforceable data sharing agreement or data use agreement. Drafting and negotiating a data sharing agreement is how we really gain consensus with the project stakeholders to document those terms for sharing the data and to memorialize the understanding of the parties. So we'll highlight terms to include in a DSA that we think can help minimize disputes or misunderstandings later. And then we're also briefly going to discuss the differences between a legally binding DSA and an MOU, which is not always legally binding. And of course, long before you sit down to draft the DSA, you will want to have evaluated the applicable law and determine whether the data can be legally shared and under what authority. So that's why we're on step 5 in the process. Next slide, please. So data sharing agreements, this is a document that's going to outline the terms and the scope and the details, the rights and responsibilities of the party to share their data while also protecting the privacy and confidentiality. It is legally enforceable. It's going to be like any other legally enforceable contract with relevant laws cited and the procedures to address compliance included and lots of other things. You'll also have consideration, which, if there's any other lawyers here, you may recall, or in my case, barely recall from our contracts class. A memorandum of understanding can be a little bit different. This can outline broad concepts of mutual understanding, goals, or plans shared by the parties, but may not create a legally enforceable obligation. It's going to depend upon the intent of the parties. So they're often used by government agencies in cases where the parties are not seeking a legal commitment to each other, but want to engage in an agreement of principle or shared vision. Sometimes it's like a precursor to an actual contract to see if the parties want to keep dancing with each other. So you may end up with a statement or a vision of cooperation for data sharing, but the document doesn't create a legally enforceable obligation. It's helpful because it can avoid that lengthy contract review process. And like I said, move the parties closer together to, a DSA or a DUA. But on the other hand, because they're not legally enforceable, there is fewer legal protections. And then especially if one party, thinks it is and the other party thinks it doesn't, or there's less clarity, it can make things a little bit murky. And I do want to underscore that just because you call something an MOU, if the intent of the parties is to create a contract with legally enforceable obligations and you have one party doing X in exchange for the other party doing Y, just because you called it an MOU doesn't mean it's not a contract. But for clarity's sake, it may be helpful to not call it an MOU because there is that kind of gray area there. Next slide. So for those of you who are veterans at drafting data sharing agreements, there's probably no surprises. For those of you with less experience, I can just share a few things that in our experience makes for a good data sharing agreement. You want to describe the relationships between the parties. You want to have the purpose. So it's key to define the project's purpose and goals and how that data sharing supports them, and being clear on that early in the project. And then again, in the DSA drafting process can help provide the focus if the negotiations get complicated or difficult. So you can go back to like, what are we trying to do here? What were our initial goals? Like, how can we make this happen? Legal authority. So the contract or the agreement needs to demonstrate that the proposed data sharing is legal under all applicable laws. And you'll likely want to cite to the laws or maybe even include specific language in the contract that mirrors like the permitted disclosures under the laws. that can be helpful, and this may also be tied to the purpose too. So, the law permits data sharing for X purpose, and the purpose of the contract is for, this. Terms, this can be things like limits on how the data can be used once it's shared. So going back to our case study, just because the Medicaid claims data went to the county health department, they don't get to use it for whatever they want to do with it or redisclose it to a third party. I'm also a big proponent of like having an ongoing DUA. And I think this is kind of caught on, but this is based on experience that I used to have working with state agencies where they would execute, and it was quite frustrating to a lot of staff, execute these like one-off DUAs for what was intended to be an ongoing data exchange. So 6 months later, they'd be back there having to do a new DUA, and it was just like a huge drain on staff time. So if you're expecting this to be like a regular data sharing relationship, make sure the DUA reflects that. And of course, there are some data sharing initiatives that are single point in time, and then you would want the contract to reflect that too. I think making termination easy, having a provision for termination in the contract and making it easy is important, 15 or 30 days notice maybe. And then data elements. So you're going to want to specify in detail the data elements so that the parties providing the data are certain that they can provide them, and the party receiving the data confirms that they're getting what they need. Again, going back to our case study, you want to think like you're going to need identifiable data from both the county and the municipal housing authorities, as well as the state health oversight agency. Because if you can't link it, then you're not going to be able to do any analysis on it. You could include the data elements piece as an appendix to the contract or to the DSA or DUA. That might make it a little easier to swap it out if the project evolves or grows or new partners are added. If it's sensitive data, you're going to want to clearly identify who can access it and for what delineated purpose. And then you're going to want to have things like in there about compliance. So what level of security and privacy of the data is required by law or by the parties. If there's requirements around storage and data destruction, those should be in the agreement. Important if there's a breach of the data, who do you notify and what is the timing around the breach? Because many laws do have like, you need to let the individual know that their data has been accessed within a certain period of time. But if you don't know if that data has been breached, then you can't fulfill your own legal obligations. Next slide, please. So some of this is kind of a little bit repetitive from the previous slide, but just quickly, definitely reference any minimum security requirements. Again, this could be included as an attachment. Any sort of legal prerequisites or conditions that are going to be passed down to or passed on to the entity signing the contract, even if they're not subject to that law themselves, that needs to be in the agreement. If you're having multiple agreements, you want to make sure that the agreements are all compliant with the others. So you don't have entities that over here, like they're doing one thing for this data project and doing something different for the data project over here in this organization. And along those same lines, each organization is going to want to make sure that the contracts comply with their own policies, internal policies. And then if there are additional policies that that entity signing the contract are going to be subject to, then those should be available, either as part of the contract or in a separate repository or document. So community information exchanges, going back to that again, they sometimes have, data policies. So you might sign a participation agreement, and then you're also going to have data policies that you'd be subject to. The person signing needs to have legal authority to sign. Make sure you have that. And then consent. So if you are obtaining consent for your project, you want to make sure you're clear in the agreement who's responsible for obtaining the consent and who's going to be documenting that consent. Next slide. So just very quickly on this slide, you can see the application to our case study. I'm not going to read this to you, but you can hopefully, go back and review it. This isn't like an actual agreement, it's a little bit shorter than a contract would be, but you can see how the different terms of a contract are kind of laid out. For things like definitions, this might be things like agency names. You're probably going to have HIPAA reference, probably the state regulation. state regulations governing how the agency can protect Medicaid data and other things included in here. And you can see also the privacy and security requirements are in there as well. Next slide. So just to recap, with Pathways, review your relationships, develop a use case, create a data flow map, conduct the legal analysis, and then establish the terms of sharing, which will be memorialized in a data sharing agreement or a data use agreement. Next slide. And then we have lots of resources on data sharing at the network. Here's just a sampling. Our website is also slowly in the process of being revamped. I'll just be honest, it's a little hard to find things sometimes. Sometimes not, but sometimes that's the case. So if there's something you're looking for, feel free to reach out to me or Steven, and we might have an idea of whether it exists and can point you in the right direction. But we do have a lot of things on our website about data sharing, about laws that pertain to data sharing. So lots of good information there. And then now we hopefully have a few minutes for questions. Oh, I see one in the chat about will the slides be available? Yes, my understanding is that the slides will be available. I don't actually, so if anyone does have, Dan, do you want to just come off mute and ask?
Yeah. So hi, I gotta lower my hand. My name is Dan. I'm from Ottawa County in Michigan, and in the past, working with just a very few DUAs, people have come and gone that were on them, saying that they can or cannot access the data that we're receiving. Um, and certain jurisdictions were more likely to have like a whole appendices section where like each individual had to sign an agreement and then send it up to the data owner. And some other jurisdictions were more lax in it. Is there a best practices to your understanding about there's an agreement between two like jurisdictions, but then the individuals who have actually access and the analytic power for the data actually um, doing it? Is there like some come and go kind of best practices for that? Hope that made sense.
I can jump in if you want, Megan.
Yeah.
Yeah, I definitely seen. I mean, I think what you described, Dan, in having an appendix that has the specifics on who can access the data is one way of trying to simplify it because of the people will change. So that avoids the need to have to execute an entirely new agreement every time somebody changes over. But to be honest, like what you just described, in my experience, has been the solution. Rather than, I don't want to say rather than the problem, but you know, the problem, the really sticking point is when you have everything in one data use agreement that includes who can access the data for what. I've found it easier to have a data use agreement that then has certain appendices or even a task order that then for each specific use of the data, like maybe has a task order that spells out what the data is going to be used for, what are the data elements, all those other bells and whistles that the specifics to the particular data exchange. Again, putting that in a task order or an appendix rather than having to then renegotiate the agreement every time something changes or every time there's a new exchange of data.
Okay, that's super helpful. Thank you. I didn't even think about the task order aspect. So yeah, that's great. Appreciate it.
Sure.
Other questions? I think we have like a minute or two left.
And if folks want to come off mute,
Just chime in, jump
probably
in.
easier than the chat. I'm seeing a countdown clock here, Megan, of 51 before we join. So maybe we should wrap it up.
Yeah, I think so.
Yeah, I just want to take a moment to just thank everybody for your participation today and entering your info in the chat and listening to a long presentation on data. We hope it was very helpful, and we really do appreciate the invitation to come and speak to you all. Megan?
Yeah, thank you. It was great to be here. And please do reach out if you have questions or there's things you want to follow up on, because that's, a big part of why the network is here to provide that kind of assistance. And we love to hear about people's data sharing projects too. So it's a win-win. So thanks, everyone. It was nice to see everybody today.
Yeah, thank you, Megan and Stephen, for this presentation and for your insights. We really appreciate it. Yes, the slides will be made available as well as the recording.
A lunch break. When we come back, Jake will be introducing the speakers for a featured presentation on adding generative AI to your toolbox, and then we will have another set of breakout options for you to choose from. In the meantime, please feel free to take care of yourself, stretch, grab some food, some coffee, some water, whatever else you need to be present with us today. But please be sure to be back right here on this Zoom meeting at 1:30 Eastern Time so that we can stay on schedule for the remainder of the conference today. We are going to go ahead and close this meeting room. We have a couple of Zoom setting things that we'd like to do that we can't do while we have it going. And part of that will be making it so that you can all chat with each other. This was an experiment that we tried, making it so you could chat with just co-hosts and hosts. But we'll go back to making it so you can chat with everybody. So feel free to hop off, go grab your lunch, go grab some coffee, whatever else you need. And we will see you back here at 1:30 Eastern Time. Enjoy your lunch break, and we'll see you soon. Thanks, everyone.